Hi friends. There is a lot of fear and confusion around the coronavirus called COVID-19, and some elements of the media give out information that many perceive with fear. But fear is the last thing anyone wants to spread, because even a global pandemic does not mean that it is the end of the world as we know it. Data about the infection is as of now restricted, as it will take a ton of research before it is completely comprehended. In the meantime, information is power, so this list contains 10 things you should know about COVID-19 and how to best shield yourself from misinterpretations, mistaken assumptions, and inside and out lies about it. This data is only a hint of something larger, so keep up to date on outbreaks in your area from official sources, and everything should be fine. So, let's begin. The infection itself likewise has a name, however it's somewhat of a significant piece: Severe Acute Respiratory Syndrome Coronavirus 2, or SARS-CoV-2. Some portion of that abbreviation might be natural, seeing as the world previously experienced a comparable flare-up of SARS in 2003. The infections are connected, and it wouldn't be not feasible to call this new episode SARS 2.0, however you likely won't hear any expert virologists state that in the media. Notwithstanding, COVID-19 is a coronavirus, and it is spreading, however that is not a reason to worry, rather, it's a reason to get ready and ensure ourselves similarly we do when it's cold and influenza season. COVID-19 is a coronavirus, which implies almost no to a great many people who don't work in virology or immunology. A coronavirus is a gathering of infections that can contaminate warm-blooded creatures and winged animals. In people, they can cause respiratory tract diseases, a large number of which can be treated with over-the-counter drug. The so-called common cold is the result of a coronavirus, and while most are well understood and rarely more than an inconvenience, some can be lethal. COVID-19 refers to the outbreak of the disease, which is broken down as Coronavirus Disease 2019. The infection itself likewise has a name, however it's somewhat of a significant piece: Severe Acute Respiratory Syndrome Coronavirus 2, or SARS-CoV-2. Some portion of that abbreviation might be natural, seeing as the world previously experienced a comparable flare-up of SARS in 2003. The infections are connected, and it wouldn't be not feasible to call this new episode SARS 2.0, however you likely won't hear any expert virologists state that in the media. Notwithstanding, COVID-19 is a coronavirus, and it is spreading, however that is not a reason to worry, rather, it's a reason to get ready and ensure ourselves similarly we do when it's cold and influenza season. It's notable that the infection was first found in Wuhan, China, however it's not completely seen precisely where it began. COVID-19 is likely a zoonotic infection, which implies it very well may be transmitted among creatures and individuals. This has driven specialists to search for creatures that may have initially conveyed the illness. There are a ton of likenesses between COVID-19 and two bat-determined strains of Beta coronavirus, which implies they are likely related. Since the infections share about 96% of similar qualities, it was at first accepted that bats were the wellspring of the episode, which was pinpointed to the Huanan seafood market, where outlandish creatures are sold. As time went on, and more research was led, Chinese analysts had the option to confirm that COVID-19 shared 99% of a similar hereditary data as a comparative infection that contaminates pangolins. This proposed pangolins may have been a mediator hab for the infection, yet the exploration wasn't formally distributed, and a great part of the examination stays unsubstantiated. While deciding the exact route may assist virologists with bettering comprehend COVID-19, doing so isn't totally important in combating the spread of the illness, since it's been discharged into the human populace. Since the main day the world found out about the Wuhan coronavirus, its dread spreading started to rise. How was it transmitted, and what should be possible to restrict its transmission? Individuals have consistently dreaded Ebola, yet that is far harder to get than something like a coronavirus, and it's everything about what it contaminates and how it is transmitted. COVID-19 causes a respiratory contamination, and it's through an individual's breath that it spreads the most straightforward. There are two known methods by which the infection spreads: individual to individual and through contact with tainted surfaces. In an individual to individual circumstance, the infection can be spread through close contact, which is commonly viewed as a separation of 6 feet. The manner in which an individual can pass it on is through respiratory beads, which are delivered when an individual hacks or wheezes. Covering one's mouth when this happens mitigates the spread of the illness, and contaminated individuals should wear a face mask to lessen the danger of transmitting it to another person. Be that as it may, if it's not too much trouble, regard the Surgeon General's admonition and don't purchase a cover except if you need one. The other way it is spread is through a surface sullied with the infection. A ledge could have been in the pathway of a sniffle, which conveyed COVID-19 to its surface. Contacting that, and afterward contacting your mouth, nose, and perhaps the eyes can bring about disease. Perhaps the greatest issue with identifying COVID-19 of every patient is that it presents a lot of like the basic virus. To battle this, scientists over the globe have been scrambling to think of an approach to test for the nearness of the infection, and this has brought about a few diverse testing strategies. Probably the most ideal approach is to check for the infection isn't to check whether you can discover the infection in an individual's body, it's to discover the antibodies the body produces to battle the contamination. The tests that search for antibodies are called serological tests, and a firm in Singapore may have culminated a methods for directing this kind of test to discover COVID-19. Antibody tests are presumably the quickest and most effortless method for recognizing the nearness of COVID-19, yet it isn't the main way. There are tests presently being utilized far and wide, which search for the infection's hereditary data in an individual's spit, mouth, nose, and rear end. These tests utilize the polymerase chain response (PCR) strategy, which is a procedure in subatomic science that quickly creates billions of duplicates of DNA per study. While these tests can distinguish the nearness of COVID-19, they cannot identify people who were infected and ultimately cleared of it. There is no known immunity to COVID-19, which means that everyone is at risk of catching and spreading the infection. That doesn't mean this is a perfect time to panic. Just because you might become infected, doesn't mean you're going to fall over dead in a few hours. COVID-19 can be hazardous, yet like most diseases, certain parts of the populace are more in danger than others. Young children, healthcare professionals, the elderly, and people with a compromised immune system are the ones who are most at risk of becoming seriously ill from COVID-19. At the point when a solid grown-up gets the infection, there's a likelihood that they won't show any indications whatsoever, and won't become ill. This is one reason the infection has figured out how to get away from the bounds of Wuhan, China, to contaminate the world. Infected people who are asymptomatic become unknown carriers, and even when an otherwise healthy adult does show symptoms, they are often mild and comparative to the common cold. The first part of this block is going to list the symptoms related with COVID-19 that shouldn't scare anyone. However, the last piece will be about the more hazardous aspects of the disease. Try not to be frightened, as these are the most pessimistic. Don't be alarmed, as these are the worst case symptoms that won't affect most people who are infected. The most widely recognized side effects of COVID-19 are fever, coughing, and shortness of breath. These are similar side effects the vast majority get from the regular cold, yet they are the mildest potential side effects an individual can experience. For those who are under a greater deal of risk due to a compromised immune system, or meet the criteria previously mentioned, symptoms can become far more severe. COVID-19 can expand the odds of contracting pneumonia. It can cause various organ disappointment, and sometimes, it can bring about death. These are the most serious cases, however all are of worry because of the straightforwardness by which it tends to be transmitted from individual to individual. Indeed, COVID-19 can take an individual's life, yet that doesn't mean the world will wind up as it did in Stephen King's The Stand. The death rate for COVID-19 is evaluated to be 2.3%, and keeping in mind that that number may appear to be low, it's most certainly not. On the off chance that you look at the death pace of COVID-19 to something increasingly regular like seasonal influenza, it's significantly higher. This season's cold virus has a death pace of 0.1%, which sees a normal of 1 passing for every 1,000 individuals. These numbers are resolved by means of the case casualty rate, CFR, which analyzes the all-out number of tainted patients with the individuals who surrendered from the disease. While COVID-19 is a lot higher than the flu, it presents as a mild infection in the vast majority of people who have had it. Most of individuals who have passed on in China have been old, and investigations of passings from the infection show that the CFR hops to 14.8% for individuals who are 80 and more established, while those between the ages of 70 and 79 have a CFR of 8%. For individuals who were at that point fundamentally sick when they interacted with the infection, that number hops to 49%, suggesting they are the most vulnerable members of the population. In reality, there are steps you can take to avoid becoming infected, and chances are, you've been doing them all along since COVID-19 is a coronavirus, which is passed similarly as a typical cold. The most ideal approach to shield from getting it is to wash your hands with cleanser and warm water. Abstain from contacting your face in the wake of coming into contact with anything generally utilized like door handles, and on the off chance that you need to head outside, attempt to maintain a strategic distance from debilitated individuals. Chances are, you do the entirety of that as of now, so you don't need to let COVID-19 overturn your life or your daily practice. In the event that you have worries about ending up in a spot with a ton of possibly contaminated individuals, you can abstain from making a trip and going to occasions with swarms, however that may not be important. If it makes you feel better to wear a face mask, you can do so, but make sure you get the right kind. The U.S. Food and Drug Administration perceives 4 off-the-rack N95 respirators, which might be viable in halting the spread of COVID-19. 3M trademark particulate respirator 8670F, 3M trademark particulate respirator 8612F, Pasteur trademark F550G respirator, and the Pasteur trademark A520G respirator. These respirators are not suitable for children or men with facial hair, so it's time to say goodbye to beard. One of the reasons there are so many conspiracy theories about viruses like COVID-19 is that few people truly understand it. Ideally, this rundown will help with that, yet there are individuals who hear a remark like, "This virus may use the packing mechanisms of other viruses such as HIV, and their minds will in general go crazy." That finding was distributed by researchers at Nankai University, and it's actual. The infection has a HIV-like transformation, however that doesn't mean somebody weaponized a type of HIV in a lab someplace and discharged it upon the world, as some fear-inspired notions have expressed. These equivalent systems show up in numerous sicknesses as the after-effect of characteristic changes. That comment has an inseparable tie to the methods for battling the spread of contamination, and research like this assists push with promoting research, which could ideally prompt a fix or immunization. You may have seen other fear-inspired notions, including one about another 5G remote framework being the reason for the infection. However, this is so absurdly bogus, it scarcely merits notice. The most important thing to do when it comes to hearing these stories is, ask yourself if they make sense, see if they are published by reputable sources, and take a common sense approach to anything you hear. The very first thing you have to do is recollect the words imprinted on the front of the Hitchhiker's Guide to the Galaxy, which are "Don't panic." Panicking doesn't support you or your friends and family, so you have to deal with yourself to guarantee you don't spread the contamination and ensure you get the correct consideration. If you develop a fever along with symptoms of respiratory illness, you should call your healthcare provider and ask for their advice. They will know the right questions to ask to help determine if you've got the common cold, or if you have something more serious. If you fear you truly did come in contact with someone infected with COVID-19 and are concerned you may have it as well, you need to get tested. Because you are leaving the house to get checked, be responsible, and keep your mouth and nose covered. This will shield you from passing the infection to others, so on the off chance that you have a respirator or careful cover you can utilize, do as such. If not, you can utilize a scarf or comparative piece of clothing. Your nearby medical clinic may not yet be furnished with testing packs for COVID-19, so call your neighborhood General Well-Being Division for data information on the best place to go.